Hello, welcome everybody. Welcome to BASWA's first digital summit. I'll explain what that is in a moment. I'm Ruth Allen, Chief Executive of BASWA. And in case you didn't know, this particular webinar about mental health and particularly the movement for social approaches in mental health marks the first of 3 webinars that we're running today. And it's the launch of BASWA's new continuing professional development programme, which starts in October, 1st of October today, developed following our consultation with social workers about what topics and approaches to learning would be most useful, and more events can be found via the BASWA website as part of this programme. So this webinar today is focusing on social approaches in mental health, and we will present some key research, evidence, some ideas, and tell you about what the Movement for Social Approaches in Mental Health group is doing, and also about how you can get involved. I'm delighted to be joined in this by 3 colleagues who are also working with me on MSAM. Just like to introduce firstly Allie. Do you want to say hello?
Hello. Hello everybody.
Hi. And Ellie.
Hello.
And also Harry.
Hello, great to be here.
So I'm in Waterloo Street, Birmingham headquarters. I'm joined by my 3 colleagues down the line, and they will be talking with you and contributing and potentially taking your questions later on as we go forward. So to start with, we're going to start this webinar with a presentation about what the Movement for Social Approaches in Mental Health is, what we are trying to do, how it relates to social work. And we hope that this whole session will be interactive, because as we come to later on, you will have the chance to submit questions, and all of us, all 4 of us, will respond to some of those questions. So we encourage you to use the chat drop down on your screen throughout the webinar and send us any comments or questions as they come to you during the presentation or during any point when people are, my colleagues and I are speaking. And we will gather them up and we'll cover as many as we can at the end. We won't be able to pick up all of them. We know there's quite a lot of people who joined this webinar, but please do send them through, because they're also great information for us in MSAM about what your interests are, what your questions are. If you would like a particular member of the panel to answer any question, please just mention that, and we can get some feeding from, get a response from a particular person. Just also to say that you will have the slides that we're going to show, and also a short useful resources sheet. So that will be coming to everybody who's logged on for this webinar. And for BASWA members, you'll be able to download your CPD certificate in your member area about 48 hours after the event. And for non-members, please email Stephanie Davies, and I'll be giving her email address at the end of the presentation. So you can email her, you can get your certificate directly from her. So I'm going to start by giving a presentation about MSAM, about what we are working to achieve, and some of the background reasons for this project and how it relates to social work. So hopefully you will be able to see the presentation now on your screens, and I'm going to go through that. The presentation will be about 10 to 12 minutes, and then I'm going to invite Allie, Ellie and Harry to provide their perspective on MSAM. So we did send out some aims for this session, and they are to explore the aims of MSAM, particularly how we're integrating service user perspectives, expert by experience perspectives and professional perspectives together. Talk about the implications for social workers, present some key research, evidence, key ideas, highlight some examples where social approaches are really making a difference. Encourage your participation, so please do join in the debate. As I said, send us your comments as we go through. And hopefully we'll have some discussion about how we can develop this as a movement. This is something we're very passionate about, and this is something that we hope we will stimulate your interest and passion to. And as I said, there's also some further reading which which links to the presentation and some of the slides as we go through. So what is MSAM? The first thing to say, I think, is that it's actually a legacy of the Social Perspectives Network, and which it's very important to mention this because nothing that we say about why social approaches and social perspectives are important in mental health is going to be brand new. It's not brand new to us, it's not going to be brand new to you. And the Social Perspectives Network is a very important legacy organisation. And BASWA has actually taken on the legacy products of SPN. It was in operation between about 2002 and 2018. And it was there to really promote social perspectives at a time when mental health services were becoming more integrated and social work and social care was coming more under an NHS management framework. So that's kind of part of its legacy. But MSAM is different, and I think that will come through as we go through. What we're trying to provide is an independent context for rethinking the social model and social approaches that really fits with contemporary challenges. MSAM is co-produced by experts by experience and by professionals. We know, in fact, that many experts by experience are also professionals, and many professionals are also users of services, so there's not a clear demarcation. But it's very important that we develop this project through that collaboration. It's being hosted in its startup by BASWA, but it is going to be, and it is already, an independent entity, and I'll come back to that. What we're trying to do is to bring together an analysis of the politics and the power dynamics that exist within mental health services with practical practice and advocacy imperatives, and that includes what social workers can, should aspire to be focusing on in practice. And although there is a sense within MSAM that by developing a social approach, developing social approaches and a social movement for change in mental health, what we're really thinking about is rebalancing the social and the psycho-biomedical, how investment, service paradigms focus on particular approaches, and making that link between mental health and equality. So we're interested in how we can be more powerful in rebalancing what we consider to be still a very psycho and biomedical approach to mental health services across the UK. And this is an international issue, which we'll come back to. So why are we focusing on this now? These statistics that you have in front of you probably are no surprise to many or most of you. And the sources for many of these are available in the resource handout that you've got. We know that there's both a rising awareness of mental health issues, mental distress, its importance, and its distribution widely in the population, but also evidence that there's an increase in mental distress and mental health problems, however people individually describe them. So we have figures around suicide, rise in child mental health problems, the fact that the mortality rate for people with a diagnosis of serious mental illness is still much higher. The fact that the detention rates under the Mental Health Act have gone up very significantly, which of course prompted the recent Mental Health Act independent review, which we will talk about later. We know that people from particular communities, particularly Black and minority ethnic citizens, but also other groups in society, are overrepresented in civil and forensic mental health detentions, for instance, but also generally overrepresented in mental health services and in controlling interventions. We know that for AMPs and for social workers and for others working in mental health services, there is a crisis, there has been a crisis in the availability of hospital beds, but also a real issue of lack of less restrictive, better and earlier options to avoid detention. And crucially, we know in this bottom right-hand corner that worsening inequality and worsening social determinants of mental health are having an impact across society, and there is evidence that this is increasing the amount of poor mental well-being across society. And if you look at these factors in the right-hand side, you see that we have increases in the numbers of children being looked after, the number of people who are seeking asylum, the numbers of people who are homeless or in poor housing, rising levels of poverty and economic hardship, rising numbers of people experiencing domestic violence, and that's most particularly, of course, women. All of these are social determinants of poor mental health. There's a big evidence base behind that, and all of these actually are worsening, particularly in parts of the UK, but in fact this is an issue across the whole of the UK. So why now? We're more aware of mental health issues, we're more aware that the statistics are going in the wrong direction. So I want to talk a bit about some of the international evidence, and particularly the work of the United Nations and the World Health Organization, and the fact that a rising level of inequality is a trigger, is an indicator of a rising risk of more mental health problems across the population. And this statistic here, which comes from the OECD and World Bank, in fact, shows you that the UK has a higher level of inequality, that's wealth inequality, income inequality, than many other comparator societies. And in May this year, the UN Special Rapporteur for Poverty, Philip Alston Kay, gave his report following his visit to the UK and made some very startling claims, which have been disputed by the government and by others, but made some very startling claims about the undermining of the social protections and the impact of undermining social protection for the most vulnerable in society, and the impact of that on health and mental health. Somebody else we'd just like to draw your attention to, you've got links to these in your resources, is Denis Pouras, who is the United Nations Special Rapporteur on the right to health. And you've got some statements here from his report from June 2017 on what needs to change in mental health services. Now, I should say that he's not just writing about the UK here, but what he's writing about is very interesting for us to think about how we understand, critique, and think about the future of mental health services in the UK. So his view of mental health services across many nations is that there's a real need to move towards a human rights approach rather than, I shall read out to you this one here, that we need to move from traditional practices and thinking and enable a long overdue shift to a rights-based approach. And he talks about, in the bottom right there, major obstacles include the dominance of the biomedical model and overdependence on medication and biased use of evidence that contaminates our knowledge about mental health. They're very, very strong statements. I should point out that Denis Pouras actually is a psychiatrist, which is interesting. But his commitment in all his writing and all the reports that he makes is to the importance of a much more social approach focused on rights, justice, and tackling those underlying social determinants for population level change, but also in how we work with individuals. Just another quote from him, what Denis also talks about is the fact that quite often we talk about that there needs to be more resources in mental health services, but he says it's not just about enough resources in mental health services generally. Some of the most stigmatizing and disempowering and less human rights compliant services are very expensive. It's not just about the amount of money that we're spending. He's concerned that a large proportion of available resources are directed to ineffective systems, still reliant on medicalisation, coercion and institutionalisation. So I think we need to think about, not only do we have enough resources in our mental health system of services, but is that money being spent in the right places? And he goes on to talk about a rights-based approach to the promotion of mental health offers an alternative to a biomedical and disease-oriented model that adopts a narrow individual focus on the prevention of mental health conditions. One of the driving factors for us in MSAM is that we understand mental health has profound individual implications, and people need individual and personalised support. But also we are part of society, and we have to understand how our collective experiences and how we're treated as a group, perhaps as a black person, as a woman, as a lesbian or gay person, how we're associated with particular groups also has an impact on our mental well-being, and how well and how easy it is for us to access the services we need. So just a final sort of international view, just to draw your attention to the fact that World Health Organization has an action plan. We're going into the final year of that. And just one of the key points from this, the tenets of it tend to agree with the sorts of things I've been mentioning already about the importance of tackling this underlying social determinants: housing, income, access, discrimination, access to social justice. But what they also say is that in their interim report, is that policy funding, research, priorities and debate are still dominated by targeting individuals and their mental health conditions. And the calls become to spend more on scaling up services that provide treatment and based on a biomedical narrative that disregards alternative treatments, psychosocial interventions, and social determinants to core mental health. So another kind of why now point I wanted to make is we've gone through a long period of austerity. We've had a lot of cutbacks in services, in health and social care. We've had significant welfare reform, which has received a lot of criticism. We have a lot of experience from users of services and people living in poverty about how some of those reforms have affected them. And one of the things we want to do through MSAM is develop, provide a platform so that we can critique policy context, and that includes where we're seeing the emergence of some new approaches and some perhaps a bit more reinvestment as the possibility of extreme austerity in the public sector, as the strings of that seem to be slightly loosening perhaps. And just very contemporarily, just this week, we've seen the publication in England of the NHS long-term plan community mental health service framework for mental health with adults and older adults. And this is signalling more of an approach towards a much more social and place-based model, which is good. But we have to, as social workers, perhaps we're good at critique, and we also have to be really skilled up in knowing what questions to ask about what new policy directions are going to offer. Sorry, just click back. What they're going to offer. And so, for instance, it's too early for me to have any very strong view about this particular document, but I'm asking, well, how social will this be? And will this new approach liberate resources for social supports and interventions? And I think crucially, we need to ask the question, I'm not going to try and answer it at all, is what will the role of social workers be in the new model of community mental health that's being proposed? And will indeed will there be a disinvestment in more clinical approaches and a reinvestment in more social forms of support? So moving forward, let's talk about MSAM and its big ideas. What are they? So our aim is that as a group, but at the moment, but as a movement going forward, as a network of people coming together, we will bring grassroots and professional power together to promote social and relationship-based support, and I will talk a bit more about what that means in a moment. Tackling the social determinants, that social determinants kind of public health as well approach to what does a healthier society look like, and how do we have policies that improve those things that underlie mental well-being, and social justice and human rights approach. We will be considering how these combine, or could combine, should combine into holistic support and create the conditions for well-being prevention as well as recovery and restorative support, and how these need to be supported by a new balance of investment, moving attention from the clinical to the social. The long-term plan for the NHS and the new framework talks a lot about the importance of the social, but if we don't get that new balance of investment and a real commitment to a shift in where the power lies in the system, then that really can't be fulfilled. That would be one of the things that we would be wanting to examine. So we've got these three elements that I've mentioned: a social and relationship-based approach to support and interventions, social determinants and social justice. And I just want to take a little bit of a digression really to talk about where the social model of mental health fits in this, the social model of disability. There's a few slides here that talk a bit about the social model of disability and its application to mental health. And this is something that we are still developing and thinking about within MSAM. And it's something that we will write about and put out more information around. The roots of a social model of a social model of mental health really are within the social model of disability, which emerged in the 70s and 80s. Mike Oliver was a key proponent of this. And what that basically talks about is how there's a distinction between individual impairment or a condition that a person might have and how society disables an individual with that impairment. And disability is seen as the negative social response to such impairments, creating disability is the creation of barriers, discrimination, restrictions, hostility, stigmatizing attitudes, inaccessible environments, very practical things like transport, people actually in wheelchairs, their actual accessibility to ordinary life, but also culture, communication. And so there's a kind of compounding effect. So people may have difficulties from their impairment, their physical condition, or their other kind of condition, but the world around them compounds the difficulties by their response to it. And there's a reference there, and you've got the reference in your information sheet, and that's about the work of Peter Beresford et al., which kind of really looks at the social model of disability and thinks about how that can be developed and refreshed and really made appropriate within the mental health context. So I'm going to just skip over this slide. You can have a look at that when you get the in the slides that have been disseminated. That gives you a little bit more on that. But what we need, what MSAM will do within its work is think about how a new social model of disability and mental health can really emerge. And again, the work of Peter Beresford et al. Is really important in that. They did a very important piece of research with a lot of qualitative interviews, and what they found was with people with mental health issues, as well as other commentators, felt that sometimes the social model as it originally been conceived, they felt a bit uncomfortable with how it drew simplistic distinctions between the personal, the social, the psychological and the social, and highlighting the need to recognise the interactions of the two. And what the authors advocate is a need for an extensive and more sophisticated discussion about social approaches which fully and equally include mental health service users. And that is what I think MSAM is trying to achieve. So I'm going to come on now to the to how we're going to approach these three areas that I mentioned in an earlier slide. So this is the slide that was up earlier. I'm going to come back now to finish the presentation by talking about what we want to do in terms of numbers 1, 2 and 3. So firstly, promoting social and relationship-based support and interventions and the principles around that. I'm actually going to go to the last point first. One of the things that's really clear from the work that we've done already is that people who use services often don't know what they can ask for in terms of a social work support, social type of support, an approach that takes account of their family, the groups that they're part of, the networks, the community. It's not clear how mainstream mental health services are making social work and social types and relationship-based supports available to people. And here are some of the principles that we think should be underpinning that kind of approach, and the fact that people should be able to reliably be offered and know that they have a right to be supported in these ways. So that's the first one. The second, promoting the social determinants of mental health and well-being. So we will be offering through MSAM the critique of some of the impacts of mental health and other kinds of national policies that I've mentioned. That you can't, our approach is that you can't talk about mental health, rising mental health issues, rising use of exponential increases in the use of antidepressants, for instance, in the last 10 years. You can't understand those things unless you understand the wider social context in which people are living, increases in poverty, increases in exclusion, changes to welfare benefits system and disability work assessments. That we have to, as social workers, understand that that is what people we're working with are living, are dealing with, and that we need to use our voice to create a different narrative and an approach that says these things can be different and they need to be different in policy. And finally, promoting social justice and human rights. So here are some of the things that we intend to do through MSAM. Identifying human rights violations in mental health care. It is still a big issue. We've come a long way since the asylums, but there are still issues around human rights violations, and actually we hear them in the news affecting people with mental health problems, people with learning disabilities and so forth. We hear about that a lot. We will critique and speak out on wider social policies, as I've mentioned. But one of the key things also is that we've used the word movement in this initiative deliberately, because we need to work with others. When I say activists, I mean that in the broadest sense. I mean the active social worker who just wants to make a change to improve the circumstances and the services for people they're working with, through to user organisations and quite radical organisations that really are fighting for change and have done so for a long time. So finally, to say something about how we're supported. MSAM, as I said, is not a BASWA organisation. BASWA is hosting it, incubating it, if you like. We are currently supported by Nesta, which is a funding organisation that is developing its methodology around supporting movements for change, movements for social change, movements for change in healthcare. And that's a few things that we say we will do. I want to just finish on this last point. We are particularly keen that we will work very closely with existing user-led organisations, as well as bringing multi-professional and expertise by experience together. One of our key motivators was the fact that many user organisations are really struggling to survive. and have lost a lot of funding. We don't want to tread on anybody's toes in that regard. We want to work with them and provide a platform. So there's some contact details. What I'd like to do now is turn to my colleagues down the line who've been listening patiently to me and ask them to say a few things for a few minutes each about why they're involved with MSAM and what it means to them. So can I turn first to Allie? Allie, can I ask you and say a little bit about why you're involved with MSAM? Maybe introduce yourself a bit more as well.
Certainly. Okay. Hello again, everybody. So I'm currently a member of the MSAM steering group. I have got some long-standing and diverse involvement, service user involvement, and that's really following my various diagnoses. There's 3 or 4 rather serious diagnoses that actually my personal journey led me into the service user involvement movement, because literally of the appalling states of the services that I and others were receiving. So to mention but a few, we know about horrendous wait lists. That means late intervention, that leads to crisis. And as we all know, the suicide levels in crisis now is just, off the Richter scale. And also the aftercare following discharge, discharge from any type of service, whether it be that your local community mental health team, whether it be if you've been hospitalised or even in a therapeutic community. So for me, mental health is actually the zeitgeist right now, and the work with MSAM is work in progress. I don't think MSAM is simply to raise awareness, but more become a network of networkers, I think, as Ruth also mentioned. And together we can influence change to implement the social approaches, not just the biomedical model. And for me, the time to change is now. That time is right now. We can hear time and time again that the government start with intent for the social justice, but it just doesn't manifest. So for me, MSAM is a rich environment. I feel very involved, very valued, and the collaboration and the co-production that we do is really important moving forward.
Ali, thank you. Could I come to Ellie now?
Hi, yes. I'm also on the MSAM steering group, and I've also been on the core service user group for the Mental Health Act review last year, and I do training and recruitment for Think Ahead. So I was going to say a bit about why I got involved with MSAM. And why I feel it's important. I remember very clearly once trying to get my care coordinator at the time to let me use approaches that weren't just medication, and she came back with a care plan that had employment, mental health, everything, and how she was going to meet that need was medication. So I felt I wasn't getting anywhere there, and I also I found when I joined Think Ahead that I was learning about all these social interventions that I'd never even heard of, even though I'd primarily had social workers as my care coordinators, for example, family group conferencing. So I think there's quite a need for pressure to have more social approaches within mental health services, because they're very often just not there at the moment. But I think another aspect of MSAM is that we will be looking at social approaches on a wider level, how society is operating. So looking at some of the things Ruth was saying about the social model, how I've been affected is things like I need flexible working. It's been great for me in the last couple of years when webinars and Skype and everything has become much more widely used, so that I can do stuff from home, and that's opened up things for me that before I might not have been able to have. But there's also other things in society that have been very difficult with austerity, like the complete decimation of adult education funding, really. both the local colleges and university fees, all that kind of thing. And then particularly for people with severe mental illness, the social context of austerity. I mean, when we talk about the UN visits, the UK has actually been condemned by the UN for grave and systemic human rights abuses, and so few people know that, and I think that's quite shocking, really. And I think where social workers can kind of help is the professional bodies could have position statements, perhaps they already do, on how the DWP is behaving. Frontline social workers could, as some already do, support people with letters to support them in their applications. And I think if things were going to be different, if MSAM was achieving its goals, we wouldn't just be seeing changes in services, but we'd be seeing huge changes in social policies that would also, as well as preventing mental health problems, that would also support people in recovering, and creating a situation of genuine resilience, where resilience is due to the support and environment around you, not seen as something that's just internal that you have to do a bit of mindfulness about. And if we were achieving our goals within services, then I think a range of interventions like the ones I mentioned earlier, and also funding for alternatives, so still part of like free at the point of use NHS care. And we have to remember the NHS is a social intervention. Within it, you might have medical model, but free healthcare is a social approach to help people. But there would be a range of alternatives, perhaps outside, like we've talked about, crisis houses, things like that, under user-led organisations or charities. And so just to quickly come on to one thing I feel very distinctive about MSAM is that there's a lot of challenging of the biomedical model, and it can get very bogged down with arguments about kind of the etiology of mental illness and how we understand it. But one of the issues is that however you understand it, better social environments can still help, whether you see it as a genetic problem or you see it as a response to trauma. And one of the things MSAN wants to do is be a thoughtful movement that tries to navigate these multiple perspectives and value social approaches rather than just put itself in opposition to the biomedical model. And that's where we try and navigate between a huge range of different understandings and different user-led groups, but what the commonality is a desire to see more options, more social approaches. So yeah, that would be what I'd say.
Ellie, thank you very much. Harry, can I come to you now?
Yeah, great. So just to introduce myself, I'm Harry Sewell. I've been working in the public services for a very long time in leadership roles, both in the NHS and in social care. In the last 10 years, I've been working independently as an author, covering issues around equalities and social justice, but also delivering change through training programs and supporting organizations. A lot around leadership, a whole lot around issues of social justice and equality, both in terms of service delivery and the workforce. So that's who I am. I think my interest in the MSAM is partly because I was there at the start of the Social Perspectives Network that Ruth referred to earlier on, so kind of already part of that legacy. So was very interested when I heard of the potential for some kind of future way of really trying to advance social perspectives and social approaches. So became part of that core group and remains so. In terms of what kind of motivates me to remain involved, the first thing for me is about the kind of bringing together of dispersed but shared interests in social approaches. Many of us will be familiar with the kind of vision of people being in an auditorium or a stadium with lighters or their mobile phones, and then they're asked all to light your lighters up, or turn your phone lights on. Then all of a sudden you get all of these individual lights coming together to create this brightness. And for me, that's a kind of an analogy of what it's like being in the movement, that all around the country, even around the world, there'll be individuals or individual groups and interest groups who are working towards the same thing. And it can kind of feel like we're individual isolated voices. But when at the same time we act in coordination, we can then kind of create a bright light, and hopefully that elimination of the potential for different ways of approaching mental distress and the impact of trauma on people's lives, hopefully that shining of a light will help move things forward. The next thing that keeps me engaged in MSAM is really this desire to push back against the current narrative around issues of social justice and inequalities, where it's kind of seen largely in the discourse in politics and in some places in society that in some ways identity politics is taking over, that people can't be themselves, that what we're doing is beginning to advantage groups who were otherwise seen as being on the margins. And that narrative is becoming so dominant that it's quite normal for those who already have privilege to flip the conversation and almost be posited as the victims in terms of injustice. And I think, one of the things that the movement for social approaches in mental health can really do is to really critique what's behind the kind of desire for people in positions of power or with privilege to retain that. And it might be about some of the paradigms underpinning mental health as it's seen now, or it might just be about how different interventions are available to some groups and not others. There's a whole lot of conversation that could be had if we kind of push back against this narrative that seems to be becoming more dominant. And I don't need to kind of name individual politicians or political parties. It's just kind of part of the discourse now, as I say, is kind of moving away from what was a language of social justice. And the third and final aspect that kind of really keeps me engaged and that I kind of really have a desire to see MSAM get to is the resistance against the kind of individualized ways of understanding people's challenges, but also the kinds of interventions that might support them. And we already heard from Ellie kind of talking about exactly that thing about locating distress in people's heads. And actually our movement is very much about linking the stuff that happens in the external world with what happens in people's minds and people's bodies. And yet the act of resistance will be hopefully around offering critiques, offering frameworks, so that people who are working in their individual environments will be able to raise challenges, but also in coming together as a movement, our voice will become louder and louder, and hopefully the discourse around mental health and within the mental health system will change to be more aligned with social approaches. Thank you.
Thank you, Harry. Thank you. We've got some questions coming in, which is great. So we're going to get to your questions shortly. I've got a kind of question that I'd just like to put first to Allie, and the question is, what would be different for people using services if social approaches were stronger in mental health? What difference would people be experiencing?
Yeah, okay, Ruth. So I've spoken about this quite a lot lately, at least not at the party conferences. And I think for me, it's so obvious that right now it's the 19th century, it's not the 20th, it's the 21st century, not the 19th century. And things aren't moving fast enough for the society that we live in and the mental distress that's around. So the focus must be on our well-being, on our wellness, not on our mental illness, as it seems to be. And I really feel passionately that this must be accepted by society in its entirety. You know, it's a bit of a cliche, but we are stronger together. So I think, you know, if the social approaches are stronger, that social justice via the social approaches will empower service users. It'll make us feel more worthy, more of a normal citizen, not like a second-class citizen anymore or judged. And I think that it can really help us to reclaim our identities, hone and learn those new skills if we need to learn the new ones, but hone existing skills. For those that can return to work, maybe return to work, get out of the isolation, avoid the crisis, avoid the suicides. So I think by rebuilding our confidence, we're going to feel inclusive. That's going to lead to living with somewhat dignity. But most importantly, I think to enable us to identify with our social workers and determine those social approaches that are going to work for us, because they're really critical to the recovery, really, of our emotional well-being. And the final point is, you know, in the ideal world, I'd like to kind of see, you know, those people that can be helped to move back into work. You know, the DWP versus the work dilemma, especially when you're doing service user involvement. Those that manage to get back to work, let's take a percentage of that work, of that money from the benefits money, put it back into education, tools and facilities, knowledge for all of those social approaches that we can build on. And finally, I think it needs to be done with parity. I've often said it shouldn't be a UK postcode lottery. So I think really society should be helping to enable us and certainly not to disable us as it is currently doing.
Allie, thank you. Ellie, did you have anything you wanted to add to that about what would be different?
I think Ali said it all very well, and
yeah. I
think we should move on to questions soon, so I'll skip that.
Okay, thanks. Harry, can I just come to you? We've covered this a bit in the presentation, but is there anything else you'd like to say about the relationship between a social approach and advocating for human rights and social justice? How are these things connect? You know, what is the connection from your point of view?
Well, I guess often, so for example, if we juxtapose that with the social inequalities approach, often, you know, we'll look at the social determinants and we'll think about some of the kind of interventions at that population level that might deal with that. So, for example, we'll kind of look at better housing. We'll look at, you know, how we can kind of, you know, reduce economic inequality, address poverty, and kind of look at the fact, for example, that women are more likely to be in social and economic inequality than men. So we'll kind of, you know, think about interventions that will deal with that, and that's good. I think the kind of human rights and the social justice perspective takes it a step further and really tries to say, well, what are the kind of underpinning assumptions that create these inequalities at population level, so that we can say it isn't an arbitrary thing that there are certain groups who end up in poorer housing, or who end up being more unemployed, or who carry the burden of caring and, you know, face, I know, sexual violence. That these kind of, you know, patterns in our population, and the kind of human rights and social justice approaches are linked, because we start to shift the discourse from saying, okay, let's just kind of deal with the problems as they present, either as individuals or as groups, but it starts to say, well, what are the power dynamics that underpin these patterns at that population and the socio-political levels, and then starts to place a greater responsibility upon us to address those bigger issues. And that takes a lot of time, because it means for those in power to start to relinquish some of their power bases. And the direct link with the human rights is because we understand through the legislation that, you know, there are human rights. And even though there is not a recognition that they are being violated, if, for example, you look at the sexual violence against women, that's a very clear example of where people's human rights are being violated. And if all we do is to enable people to live better with the consequences of those, you know, attacks or infringements on the human rights, then we allow stasis, we allow equilibrium, we allow the current things to be maintained. And actually, what we need to do is to get to the point where we start to disrupt the things in our society that mean that, you know, those patterns persist quite consistently over time.
Thank you, Harry. Thank you. I'm conscious that we've only got 10 minutes, but I've got some questions from the audience as well. There was just one thing I wanted to ask Ellie before we get to that, because one of the key things is, how do we know what works in relation to moving towards more social approaches in terms of social work support and social approaches to support. And Ellie, you've been involved in the evaluation of a particular approach, the Connecting People study, which was led by Martin Webber at York University. Could you just say a little bit about Connecting People, just what it was trying to achieve, and
Yes,
what the evaluation found?
Yes, I think due to time, if people want to follow up on this more, there is a Connecting People website at www.connectingpeople.net, which is quite comprehensive. So this was looking at an intervention to increase social capital for people within secondary services. And a pilot study had been done which showed that when it is followed with high fidelity, it does work, it does increase social capital. So this was an implementation study at 5 mental health trusts, and with a thorough toolkit, a lot of support to try and ensure it was implemented. For example, they were given £1,000, the teams were given £1,000 for training and other support. And it got good follow-up, 84% follow-up of the participants. But what we found was that it wasn't implemented very well at all, because it wasn't implemented with high fidelity. So there was no difference between the control group and the implementation groups. And without going into any real detail on it, basically we decided, in the current climate where services are just in crisis mode all the time, it's practically impossible to implement this kind of social approach, and they're thinking that it would have to be done in other sectors, like the charity sector. In the pilot study, all the teams apart from one that achieved high fidelity were in the charity sector. So that's sort of brings in those wider social determinants of policy. If you don't fund services effectively, then it can be very hard to make a difference to have these social interventions available. Okay.
Yeah, no, that's great. I think it was really fascinating, showing how you need to provide the context and shift the whole paradigm to enable social approaches not to have to effectively compete and then get squeezed out by potentially less effective or dominant forms of operation, and kind of the barriers can be set up in the way services are currently organised. So that's it's a very interesting study and worth people having a look online. So I've got a couple of interesting questions, quite a few questions. I'm just going to pick out a couple from our audience. The first is a question about engaging local councillors and different levels of local government. So kind of how do we maybe engage the local politicians in making a change? Harry, could I ask you if you've got any thoughts about the importance of engaging local leaders around this agenda?
Yes, certainly. I kind of think there's an economic argument as well as one around kind of ethics and morality. So a link I'd make is, I remember in the acute hospitals when they were spending a lot on hip fractures, and they kind of started to have conversations with the local authority to suggest, well, why is it that the NHS is picking up the cost financially, and in terms of the volume of activity around all the people who are tripping on pavements that are uneven, because it jams up the system. So that conversation was had, and some local authorities were responsive to kind of paying more attention to levelling out uneven pavements. I think we could advance those kind of arguments, but what it would require is for us to kind of be clearer around the evidence base. So that there is emerging evidence, for example, around the impact of racial inequality, on and the link with trauma on people's mental health, or the kind of experience of young girls, young women being physically and sexually abused, and the kind of impact of that trauma on their mental health. And I think the more we package up the data and say, well, look, actually, we have an evidence base that the kind of social circumstances are directly related to kind of poor mental health outcome, then we can kind of have conversations that will hopefully draw them in, because there will be a gain both in terms of the experience of living in local communities, but also in terms of the kind of finances, if we look at it as a whole economy, not just compartmentalized.
So something about how we describe what social approaches means in practical terms to influence councillors, local politicians, commissioners in health and social care, and how we actually demonstrate the importance of that and what that looks like in terms of different services. It links a bit, we've got a question in about AMPs actually, social workers as AMPs working in a risk-averse environment. How can we get back on track? I'm just going to kind of quickly attend to that one. I think I was really keen that this work is seen to be highly relevant to AMPs. And I think it's crucial about how AMPs are able, in their legal role, in their assessment role, able to use this kind of thinking to raise the issue about not having alternatives to admission and not being able to provide earlier support, not being able to, as social workers, 96% of AMPs are social workers, I know some aren't, but this applies to them as well, being able to work perhaps earlier with people around in a more preventive way, using a more person-centred approach, being able to mobilise those aspects of being a social worker earlier. It is a question of the resourcing that's available, but it's also about the models of service. It's about whether or not services are set up to allow us to be working earlier and to really prevent crises. Would just say that the advanced choice that's being proposed in the Mental Health Act review may assist with some of this, about getting alongside service users about what they know will help keep them well. I think that may be an important shift if we get that as a change in legislation. We don't know yet, it's just a review. We don't really know yet what of the Mental Health Act review is going to come forward into changes. We've got a question about a specific question about, has NSAN been involved in the planning of MSAM? NSAN is the National Survivor User Network. We've certainly been in dialogue, but I'd just like to ask Allie or Ellie just to say a few words about our dialogue with NSAN, which is a leading user organisation who we absolutely want to be working in alliance with. Allie or Ellie, would you like to just say a few words about that?
I can come
Ellie,
in.
do you want to talk? Yep.
We've got about a minute. So.
Okay, we had Dorothy Gold come and meet with us and talk through our ideas, for example, about trying to give user groups more access to all parliamentary groups, things like that. Quite a few of the things we were suggesting she was very in favour of, and we have kind of gone from there. I'll also be going up to their AGM on the 24th of October, I think it is, where they're discussing their campaign, the value of user-led groups. But I do think at the moment we do need to get more engagement with user-led groups.
Yeah. So thank you. I'm going to have to draw it to a close because we've run out of time. I just want to say thank you very much to Allie, Ellie and Harry. On that last point, I'd just like to end with that. One of the key points about MSAM is that we improve the experience of people who need to use services, but we also have an impact over time on a more healthy, mentally well, high mental well-being society. This has to be led to a large extent by people who've got direct experience of using mental health services, and for whom they've got a massively high stake in making the changes, and developing the ideas through user researchers as well as user activists. So we're absolutely committed to working in alliance with user activists. We are a co-produced movement. We'd like you to get in touch and join with us, and maybe just to find out more, you can see from the slides that you can email Stephanie Davis to express your interest. We look forward to meeting many more of you, and we hope that you will keep in touch and keep a watching brief on MSAM as it develops. Thank you very much.